friends, it's always a pleasure to welcome you to our weekly episode of Health Watch on Advent Cable Network Nigeria, ACNN. I am Angela Emeka Ebiwu. On this week's episode, we shall be discussing HIV/AIDS pandemic in Nigeria. First, let's look at the global statistics of HIV infections. According to the UNAIDS, now most of the times when I give my statistics, I mention organizations where I get my data from. So just to let you know what UNAIDS is. Now UNAIDS is the Joint United Nations Program on HIV/AIDS, and they lead the world's most extensive data collection on HIV epidemiology, program coverage, and financing. They publish the most authoritative and up-to-date information on the HIV pandemic. So, according to the UNAIDS, since the start of the HIV pandemic, an average of 85.6 million people have been infected with HIV globally, and 40.4 million people have died from AIDS-related illnesses. This is globally. As at 2022, 39 million people are estimated to be living with HIV globally. In 2022 alone, 1.3 million people were newly infected and 630,000 people died of AIDS-related illnesses. The statistics reveal that 53% of all the people living with HIV were women and girls, of which 63% were from women in sub-Saharan Africa. So now to Nigeria. Result released by the government of Nigeria, by the National Agency for the Control of AIDS, NACA, in 2019 indicates a national HIV prevalence of 1.3% among adults in Nigeria aged between 15 and 49 years. Previous estimates had indicated a national HIV prevalence of 2.8%. This shows that there has been a reduction in prevalence of HIV infections over the years, even though the UNAIDS and the National Agency for Control of AIDS, NACA, estimate that there are still 1.9 million people living with HIV in Nigeria. This data is also differentiated, by geopolitical zones, indicating an epidemic that is having a greater impact in certain areas of the country. The South-South zone of the country has the highest HIV prevalence at 3.1%, and among adults aged 15 to 49 years. HIV prevalence is also high in the North-Central zone, that's 2.0%, and in the Southeast zone, 1.9%. Now, it's lower in the Southwest zone, they have a 1.1%, the Northeast zone, it has a 1.1%, and the Northwest zone, 0.6%. Furthermore, just like the global pandemic prevalence, in Nigeria, women are more at risk of HIV than men. Thus, we have 1.6% of women have HIV compared to 1% of men. In 2021 alone, 14,000 young women aged 15 to 24 got HIV, compared to 3,600 young men within the same age. Sadly, Nigeria has one of the highest number of annual HIV infections among children in the world, and we're looking at 14% of the global total. Progress in this area is slow because between 2010 and 2020, Nigeria reduced mother-to-child HIV transmission by only 15% compared to reduction in South Africa and Uganda. That's, 70% reduction in South Africa and Uganda. So, to summarize everything I've been saying, we have a reduced prevalence, or we seem to have a reduced prevalence rate of HIV infections, but we still have a substantial number of persons infected who are capable of still infecting other people. So our discussion today will be centered on creating awareness and what we can do to avoid further spread of this infection. And, of course, much more as usual on this program. My guest today is Onyedinma Okwo. She is a health educator. Thank you so much for coming on the program. It's a pleasure to have you here. So how you do? I hope you're doing well and comfortable. Good to have you. So you have, we'll get over to it, speaking on HIV you know, and you've listened to my statistics on what I have read out, and you are more in the field on what is going on. So what's happening? Is that correct, or is there a difference in what we have now, you know, in reality?
Yeah, I just want to say that Nigeria is no longer rated, the prevalence is higher than you said.
Okay.
Because currently we have 2 million Nigerians.
2 million Nigerians who are HIV, okay.
Against the 1.9 you mentioned.
Okay.
So which means they are 2.1% against one previously 1.4.
4%. Okay.
Yes. And then in worldwide they are the 7th.
Okay, we are number 7 now. Okay.
And for the children living with HIV and AIDS, they are the 3rd.
Okay.
And then I heard you mention Uganda. They are no longer in the top 3.
Okay.
But Mozambique is the highest.
Is the highest now. Okay.
And Nigeria is the 3rd largest.
Okay, 3rd largest. HIV. So Mozambique is leading now. So our interventions has actually worked to an extent.
Mozambique, South Africa, then
Nigeria. But I mean, being on the 3rd is still high there. I think we can do better in communion.
Because globally, for every 7 children living with HIV and AIDS, 1 is in Nigeria.
That's a lot.
So
that's a lot.
It's
really high there. All right. So with all the statistics we have, we still know that sub-Saharan Africa is still highest, is still leading in the HIV infection, and Nigeria is part of it. And this number of people we have are still capable of infecting more persons and putting us more in a big problem. So if we don't do anything about it.
With the rate of children being infected, it means in the near future, Nigeria, if care is not taken, Nigeria might be the top.
They come back to the top. Now that's serious. So that's why this discussion today is very important. Okay, we're going to talk a whole lot about why all these issues we see that is different in men and women. We're going to talk about all of that. But somehow it looks as if everybody, HIV has just gone away, you know, we're no longer afraid of it, we can live our life anyhow. But let me just start with the difference between HIV and AIDS. You know, it looks like people know, but people don't actually know the difference. You know, when I say HIV infection, I'm not saying AIDS, but I'm just saying HIV infection. So what's the difference between the two?
Okay, the difference is just clear. HIV is a virus.
Okay.
The virus that weakens person's immune system.
All right. Okay.
And then for AIDS, there is no way someone can have AIDS without HIV.
Okay.
Which means it's after the system has been weakened by HIV. That is when the person can get
okay. So which is the AIDS, acquired immune deficiency syndrome?
Acquired.
Yeah. So you've
acquired. So it's a condition.
Oh,
so if there is no HIV, there will be no AIDS.
Okay, so pretty much people don't die because they have HIV infection.
They don't
so why is the level of death high? Because
they're just being careless. Like some people don't really know that they have HIV.
Okay.
And there are some people that even when they got tested, they don't want to accept it.
Accept it,
they
okay.
Walk away, and then you don't force them.
Okay.
So you have to cancel them and all that. If they don't accept it, you can't do anything
about
but they've already known that they have it.
Yeah.
But then there are some people that maybe with the intention of someone gave me, let me go and give others. They don't want to do anything.
Okay.
Because if they will have to take precautionary measures, I have HIV, what can I do?
Okay.
What help can you offer? Then something can be done. And there's no way it can lead to AIDS. They can still live their normal lives.
All right. So when you have the HIV, and it takes a while before your immune system becomes compromised, of course, and then maybe when it's going to AIDS is when your body is no longer able to.
Yes.
Okay.
This white blood, these T cells, CD4 cells,
CD4 T cells, yeah.
T cells, you can call it T cells.
Okay.
They are the white blood cells that protects infection.
Okay.
They fight infection and then diseases. So when someone is HIV positive, the virus starts fighting these T cells, then reducing the number.
Okay.
Then by the time, like the normal range of these T cells for every human is 500 to 1,200.
Okay.
So by the time it keeps fighting them, then it will be reduced. Once it goes down to like 200, the person can automatically get AIDS.
So it means your immune system is really compromised, really down low on that. Wow. So which means you have the HIV, you need to do something about it. If not, if it progresses, your CD4, which is your defense, goes down, and then you're not exposed to so many things.
Not
Yeah.
just AIDS. Because before it can even lead to that someone getting AIDS or resulting to AIDS, it can last for as long as 10 years.
Wow.
Yes.
Okay.
It keep killing,
Gradually,
destroying the T cells gradually. Then before it can result to this. So you can imagine this extended number of years. So if someone has done something,
yeah, of course,
can still live, and then it doesn't show.
Yeah. Okay, so let's remind ourselves how HIV is transmitted. You know why it sounded interesting is that I can't remember when I last saw an advert or a campaign on, oh, don't do this. There were years, a couple of years ago. Once you hear everybody's coming there, oh, don't use this. If you use this to cut your hand, you HIV, HIV. But now everybody just leaves. So let's remind ourselves of how HIV is transmitted.
Okay, there are various ways it can be transmitted, but majorly body fluids.
Okay.
Like semen, breast milk.
Oh wow.
Blood. Yes.
Okay.
Yes. So once someone has unprotected sex,
okay,
so it's very clear that the person can be
infected,
can be contracted.
Okay, can contract the HIV. Yes.
So if there is unprotected sex, if there is blood transfusion, then for positive mother breastfeeding the baby, or maybe when the person is still pregnant, because I think, I don't know, but if a woman who is pregnant didn't do anything, the baby can get HIV even in the womb. But if the person is on ART, it can be prevented. And then nothing will happen.
Okay. So she can actually, a breastfeeding mother can infect the child.
Yes.
If she's HIV positive.
Yes. Yes.
Oh wow. Okay.
Yes. But once the person is on ART, the person can still breastfeed and nothing happens.
Okay, that's when the treatment is a bit. But if the treatment is not ongoing, whether you know that you have HIV or you don't know, you can infect your child. Direct access. So do they get it from sweats and?
No.
Okay, all right.
Kissing, because some people have, there are a lot of arguments that someone can still get HIV through kissing. But it's not that.
Oh, that's not enough.
It's only when there is sore in the mouth.
Okay.
Or an injury. That is when somebody can get
blood fluid can be okay.
It's not proven.
All right. Then shaking hands, using what the person has used.
You can even
stay with the person.
HIV patients, they are living with people.
Yeah.
In fact, let me now tell you that there are concordant couples, like one is HIV positive, the other one is HIV negative, and they are married and they're living.
And they're living together.
Yes. I have one that came for testing for her baby, actually, because she's positive already. She got married positive, and her husband was aware that she was positive before that.
And he went ahead.
Yes.
Oh wow. Okay.
The thing is that she has been taking her drugs, and then the husband, they gave him preventive drugs too.
Oh.
So
wow.
both of them are on medication, and then she had 2 kids. Then the third one, then the first 2, none of them are positive. They are all negative.
Wow.
But the third one, the fear she had was that she gave birth to the third child in Keke on Easter. That was last year.
Okay.
So she said when she was, I think whether some government hospitals were on strike. So they were looking for where to even
have the child. Yeah.
Yes, when she was in labor. But on their way looking for where, and private hospitals. And then some are even observing the Easter break or something.
Okay.
So she ended up giving birth in Keke. So she said she actually tried to ensure that the baby doesn't leak blood, because she already knew that
where she was, medication,
So, but when she came for the final test for the baby, and she was just crying, like tears of joy, that thank God, because of how she gave birth to me. So what I'm trying to say is that anybody that is positive can stay with anybody. whether body contact or no body contact.
All right, so that defeats the purpose of saying, oh, I'm running away, or stigmatizing the person and running away from the person, because that is being established. Then what of cutting, you know, all the blade, sharp objects?
Yes, needle, knife, all those. The virus lasts longer in metals.
Okay.
So it can last up to more than 48 hours or thereabouts.
All right.
That is when, but in clothing like these materials now,
it doesn't last there. Okay.
Blood drops, the virus can die.
All right. Okay. So it's more of if you use the material.
Metals.
That's why they say scissors and all
scissors,
of that.
Needles,
syringe.
Don't share sharp, don't use them.
Okay. Now that makes it even clearer, because there's still some people who still have that stigma, and it's amazing to know that there are a couple that actually live in and know that the other one.
Plenty of them.
Okay. Wow. Great. So now we have had a rise in HIV in Nigeria. I mean, just like I said, we are doing as if there's nothing going on. So what do you think is the reason for the rise? You know, I've felt everybody would have been afraid now, being more careful, but it seems to be rising. What's happening?
People are not even careful. It's because of, I don't know whether I would say people's way of life or something, but it's the activities people involve or engage themselves in, like these sex workers, the homosexuals, and then the people that inject drugs. All these people are at high risk, and they are the reason why they are increased. And then this mother to child transmission, they are the reason why the rate is still increasing.
It's still high.
Yes, but because now someone, I'll still bring in this example.
No problem. Yes.
Someone came for, there was a lady that came. She actually had unprotected sex, so she came, and then what she wanted actually was pregnancy tests. You can imagine, even pregnancy, there is no way you can even discover whether she is pregnant, because it was the previous night she had the sex, so she now came the following day. So
somebody can have, in this country now, somebody can have sexual intercourse and come into a healthcare facility to say, oh, I'm not sure what happened. Is that obtainable in Nigeria?
Of course.
Oh, wow.
But people shy away from that.
Wait, I just wanted to establish that is obtainable in Nigeria, because you'll be surprised, and many people, I don't even know that you can just walk into a place. I know in other countries you do it.
Sometimes when they come, they don't want to say it direct, but by the way they will even present that, I don't know, we know. We'll just be like, what happened? Is it a regular partner or not?
Okay.
So some of them will they are just doing their thing. They can't sleep with anybody, and then they will walk in to tell you and then this person I'm talking about now, when she came, I had to conduct a test for her to ensure that she's negative first, because there are preventive drugs after exposure. Yes. So I wanted to administer these drugs to her, so I now conducted tests and then told her that she had to complete it, and then this medication, these drugs, you have to take it with time. You don't need to give it space. Any space, the virus can just boom. So that is why I took my time to explain how she can take it. But unfortunately, after a week or thereabouts, she called and said, and sorry that she missed the drug, that she didn't take it, that she went somewhere, that she was hiding it, like she didn't want someone to see. And I've already told her that even if the person sees it, it's preventive drugs. It is not like, this is the one that they are giving those that are already HIV positive. It's quite different from the one she was given. So she said, and that's okay. And I even told her, if you know that you can shy away from going out with it, you can look for vitamin C container and put it in it. How we advise them, so that they can be able to take it. And she said she missed it again. She missed it, and then I told her, don't worry, you've missed it just once. She said yes. I said, just if you're at home, just take it now. Let's see how it goes. But you must have to come back for testing. So after a while again, she called. She went back. She still had another unprotected sex within the period she's still taking the drugs, and then she still missed drugs again.
So this is actually people's behavior.
That is
It's the problem, really.
That is the problem.
Oh, I see.
So because most of these people now, they are okay, like, and then they are always careless about, like, the people that inject drugs. Anything can happen. The homosexuals, all those, anything can happen.
Yeah. So, which means one of the reasons why we're having a rise is that people's behavior towards it. Is it because they are just not ready, or they're not taking it serious, or we no longer have fear for it again?
Some of them don't even know their status. Some of them don't even know that they can still walk in and get tested.
Okay.
And they are still living careless life.
So one of the problems, people don't know their status. They don't know.
They don't want to know.
Okay.
They don't even, like, but I can't even imagine somebody that we are just doing some certain things, and then you don't even know, you don't even want to go to the hospital to check yourself and know if I've even contracted
that. Especially if you have multiple partners, you know, in what you're doing. Okay, so I'm just trying to establish why we're having this increase. Number one is people don't know their status, because maybe if they know their status, they'll be more careful, or go for treatment, or go and get help where they need to get help. And from what you have just said, it means right now in this country, if you're not sure of the kind of person you've just had any form of intercourse with, you can actually walk into a healthcare facility and then get help. Now, somebody has done this. What's the procedure? Where do you walk into? Do you go to any general hospital and say, "Oh, madam, excuse me, I don't know what happened to me yesterday. I just met one man and went in with him." Okay. And is that how it happens, or how do people seek for help?
Okay. The thing is that the people, they are already aware that there's something like HIV. They can still, maybe by the time for every general hospital, they administer this.
It's available in every general hospital. Okay, so my viewers that are watching should know that in every general hospital,
like this, in this Abuja, the Federal Medical Center, the National Hospital, the one in Maitama, would say all of them.
Okay, all right. Okay.
They can walk in, then tell them that. Because one thing I believe, if you get to the hospital, you don't need to hide anything from any health worker.
Because they
will help you.
They will help you, so they won't judge you.
If you get to the wrong department, they will still redirect you to where you get the help.
Okay.
So it's just for the person to walk in and then say, I got exposed, and then what will I do?
Okay.
It mustn't still be sex. Some people that works in the clinics or in the laboratories, they can.
Yes.
Or maybe cuts. You are walking somewhere and then there's a metal by the way, and you don't even know who has passed there, and you got a cut. You can still walk into the room and tell them you are exposed, but then they will still ask you how. Is it sexually or
something caught, or you got involved?
Well, whichever way, they will still give you the services you need.
So nobody should be shy to go to the general hospitals, because one of the things, just like you said, some people are shy, they come to pretend, and the health worker is not there to know whether you're shy. They're here to give you solution, right?
They don't care about whether you are shy, because sometimes there are people that they don't want to even open up. By the way we even interact with them, we just, like, I've got some of them that when they come in, they don't want to say anything. They will now be like, they will just be beating around the beach. I will not be like, just talk to me. I will help you. Don't need to hide anything, because if you hide anything, then you will get the wrong service. So just open up. By the time there's a way you approach them, they'll be able to tell you everything. If they need it confidential, you excuse the other colleagues, so that it will be a one-on-one something. But then there are some times that there are things that are general. A colleague can be there, they are general.
Yes,
if they need it confidential, because there are people that their own is not really, they are not willingly engaging in what they are engaging. Some people are being molested, some people are being raped.
Oh yes.
And then these kind of people, they don't want to, because they are even traumatized, so they don't want to just share it with anybody.
And they're counseling available to help these people.
We do that.
Yes.
Before every, like these preventive drugs, before we administer preventive drugs, we'll have to counsel the person. And then during testing, you have to we do counseling before testing.
Okay.
Let's even ensure that they
Understand what HIV is, yeah.
the mode of transmission, and then we even have to ask them some series of questions, whether they've even received blood in the past 3 months,
yeah,
and all that, so that we'll know, even if the person is positive, we'll be able to know how. Like I got someone one day that she's 30, I think she's 30. She never had sex and she's positive.
Wow. So there's other means of the transmission. So
yeah.
So that's why it's very important to go and do check and know your status. So this testing, do we have to go to the hospital to get I just want to know my HIV status. You can just walk into I just want to know my HIV status.
Yes, once you come to our district or any other hospital, tell them you want to know your status. And it's free.
Oh, that's say it again. It's free.
Free. No charges. Once you come to the hospital, tell them I need to know my status. You get tested. Without pay. Some people are even shocked that sometimes do not be like, how much? Or before the testing, maybe. And in fact, there is something that is happening in some clinics now, in some government hospitals. Once you come for anything in the hospital, you must have to get tested.
Oh, for HIV.
I don't know about other hospitals, but it's happening in federal staff clinic.
And some of the hospitals.
Yes. It's happening there. Once for the pregnant women, once they come for antenatal, even if you have malaria, you want to see the doctor, they will give you a request form to go for HIV testing.
Okay.
Because they need to know your status.
And it's all free.
Yes, it's all free.
So, and that's because one of the things, just like we established, one of the reasons we have this rise is people don't know their status.
Yes.
And it's free to go and check your status and know where you are and then start the necessary treatment that you need, because we're going to talk the details of the treatment, because I know there's preventive medication, there's medication when it's been established, and then how people can go through it. Before when we're going on a break now, I want to go on the quick break, we'll come back and talk about that. But what I also want to point out is, instead of going to tell your friend who is going to laugh at you or make you feel bad, you better go to the hospital and get help. Those ones will not tell anybody what you're going through, because I know stigma is another thing. But instead of sharing with a friend, walk into the hospital and get some help. We'll be right back, viewers.
In terms of true worship, we must seek the Lord. We will not be able to come with all our perfections.
We will recognize as superseding every other gift. So love, in essence, is very important. Our position is who we are. Our disposition is the way we relate to who we are. So it's not about your position, it's also about your disposition.
People of God, I want to tell you that no matter who you are, no matter your position, your status,
you have encountered that superior power, the efficacious power of the blessing.
It says this God hears prayers, and then he expands the limits of whose prayer is heard.
Welcome back, viewers. My guest is still here, Onyedinma Okoh. She's a health educator, and we have been speaking so much on HIV/AIDS and how you can get all the help. And thank you so much, Onyedinma, because there's so much information you're passing out here that I didn't even know. So, in the beginning, we're talking about the testing being free. Some people go to the private hospitals. I think it's not free there.
It's not free. They are running their hospital with money. So
yes.
They need money. They establish the hospital to make money.
Yes. So they'll charge you there. If you go to the regular labs, they will charge you. But in government established hospitals, it's free. It's free to do. All right, that's beautiful. And then, just like somebody asked us, if you go and you meet a friend of a friend, when you're trying to hide your secret to the status from the stigma, what do? You change the person, or you ask for another person?
No, you don't need to. If you get to where, you just be like, oh, I'm looking for somebody, or I came with somebody, or you just tell them that I needed to check something, but
yes,
You can leave.
All right.
And then sometimes we do help them. Like if I try seeing somebody I know, sometimes I help them. I hide. I don't want to see them because I don't know whether they'll be comfortable seeing me. I'm not always in a haste to greet someone I know. That are close to our. Because they may not be. I don't know what they came
to the hospital for.
So
all right, maybe sometimes
severally people that, in fact, the people that are even HIV positive. One of the health workers somewhere, I think it was in Asokoro, I had the story that. So she said where she was working, she was there and somebody she knew came. The person is HIV positive, came for medication. When she saw her, she was like, it's what you came for, I came for.
Oh wow.
Yes. To make her relax. But she was just a health worker.
Yes.
So she was we came for the same thing now.
Wow. Just to protect her from this.
So that she won't. So who shares? If she shares her story, automatically she's sharing her. Like,
yes. So they are both exposing themselves, so we keep our secrets. Yeah. Well, we don't need to even stigmatize it. It's not a death sentence anymore. It's not a death sentence.
People need to understand this. It is, okay. There is a friend of mine was sharing with me yesterday that in her sister's office, organization where she worked, that one of their, I think is an eatery or something, that one of their chefs is HIV positive, and then when they discovered, they wanted to dismiss her. I was just waiting for her to land. So when she now finished, I told her if this lady should sue them, she will win. Wow. She now told me that yes, that she went to court. And then the management, they were now running helter-skelter. I said, it is wrong. This is discrimination. She has the right to work. There's no way you can tell them, is she putting blood inside?
Sometimes some people even carry more worse infections than even the...
And what they don't know, HIV, even if the blood drops in the food, it cannot do anything. It doesn't last there. It will die.
It will die.
Unless she will cut herself, put the blood, which she cannot start doing. I said, this is discrimination. Why can't she walk?
Yeah.
But when they were still on the court issue, the girl on her own just left them. Let them
work for them.
So I told her that this is wrong.
This is wrong. This is not fair. So there's no room for discrimination. No. If you have a family member, brother or sister, help them get to a health facility. So that's bringing us to the discussion on treatment and prevention, preventing. So there are two different things when you go to the hospital. So talk me through that. There's the prevention, the one you take when you come to the hospital and you're not sure or they've not done tests, or how does it work?
Prevention for the drugs. Yes, there are preventive drugs.
Okay.
And this, there are two types of preventive drugs. Then one is pre-exposure prophylaxis, that is PrEP.
Okay.
Short form, and they have post-exposure prophylaxis, which is PEP. Okay. And then this PrEP, the before exposure, is the one that we administer to people before they even indulge in any activity. Like when I was saying at the beginning that we had a woman that came to get her baby tested for the last time, that married someone that is negative.
Yes.
So the one that was administered to the man is PrEP, pre-exposure. So which means she's of course she's married. He's married. So both of them will be sleeping with each other. So he needs to prevent himself, protect himself.
So he has to take the medication before having any form of intercourse.
There is a way they take it. For the people that are married, they can take it every day.
Okay.
Just take it every day. So because you don't know when the man will say, "Oh yeah, let's." They can announce it. They are married.
They are married. They are right.
But for the people that the ones that are not married, of course, we issue to them as well. For them that are not married, they will have to take it 24 hours before anything they want to do.
Wow. Okay.
Yes. If someone, some people do planned sex. So for the people that will want to have sex, they can take it 24 hours before. Okay. And then one after sex, and then one the next day. That is 2-1-1. 2 tablets, 1 tablet, and then 1 tablet.
Okay, so you take 1
3 days
before 24 hours.
Yes, 2 tablets before, then 1 tablet after, and then 1 tablet a day after.
Oh, wow.
Even the married people can still, for the people that plan. Then the post-exposure prophylaxis. This one is the drug that is administered after exposure, and this one is not just to prevent sex. Like the other one is usually for people that are sexually active, like the PrEP.
Okay.
Because nobody will tell you that I know that I'm going to have a cut. I know that I'm going to have a needle prick. So
Okay.
let me take this medication. So it's usually for people that are sexually active. But the PrEP can be given to anybody.
Okay.
So once someone is exposed, maybe sex, needle prick, cuts,
abused, raped, or
and all
exposed.
that.
Yeah.
Once they come, the person needs to start taking it within 72 hours. Once it exceeds 72 hours, it won't be effective again.
Okay.
The virus must have been there already. Like it must have started developing, so you can't do anything. So the person have to take it within 72 hours, and then take it for 30 days, which is 1 month.
Okay. This you've not tested. You the person is not sure, or you've tested the person that you know, or the person knows that the person that did whatever with is exposed.
Whether you are aware the person is positive or negative. Because if the person is showing negative, and then they ended up having unprotected sex, HIV window period is 3 months. So if somebody that is positive, HIV positive, and then is still not showing after testing, after going for a test, it can be that the person is in window period. So it will show.
It will show, all right.
So until after 3 months. So that is why, as long as there is exposure, you need to take these preventive drugs.
Drugs, okay.
To prevent it. No excuse. And it is that this one is taken for 1 month.
All right.
Yes.
Okay. So if now you go and it's confirmed that you are you are positive.
So there is no, if the person goes and is positive, there is no need for this.
All this process prep again.
Yes,
okay.
There's no PrEP again. The person needs to enroll and start getting ART.
Okay.
Antiretroviral therapy.
Okay.
So
you just start taking it, and then that you take it for the rest of your life, or there's a period you don't take it again.
Lifelong, because for now HIV has no cure.
Okay, it is managed. All right.
But then we have to know that as long as the person is taking the medication very well, the virus can be suppressed, which means there is a tendency that the person can't transmit it to another person. All
right. So the load has so reduced that.
Yes, and sometimes when the person go for testing, it will be showing like viral load. There is a test called viral load to know the copies of virus, like HIV virus in the system. That's viral load test.
No, dear.
So there is a time that the person, as long as the person is taking these drugs very well, it will get to this extent that it will be showing undetected, which means they are not seeing any virus. That doesn't mean that there is no. It has been suppressed to the extent that it can't be seen. But once the person leaves, because it has happened to some people that they felt, oh, I'm unsuppressed, and they now stopped. And before they knew it,
there was an increase again, multiplying again. All right, okay.
But when it is, they can even have like somebody that is virally suppressed, they can have unprotected sex and they can't transmit it to another person, whether the other person is being protected or not.
Okay.
They can't transmit it because the virus is not. It's something like it's not active.
It's not active. Okay, but you can't stop the treatment. Now, these medications, are they free as well, or?
Of course, everything about HIV is test. The testing, like this viral load test. If you go to, there was a time I was working in a lab. They charge 25,000 naira for the viral load test. So you can imagine somebody that is after every 6 months, some is every 1 year they go for viral load to ensure that this thing is going down, depending on the copies of virus in the person's system. Like like this virus comes in copies.
Okay. Yes.
There are some that are 1,000 copies. There are some that are 2,000. There are some people's own are already millions. And then you can imagine the volume of the copies of this virus determine how it's affecting the person.
Yes.
So that's why, as long as they are taking this medication, it's coming down.
Okay.
So they can't take it and say, okay, it's just let them.
Okay. So which means it's not. It's free.
It's free. The medication is free. The testing is free, and that is why you must have to go to the because there are some people who now be like they don't want to. Like in our clinic, people, in fact, they have the regular place for everybody. Some people want to do VIP. They don't want anybody to see them. So their own consultation is in privacy. And then for this consultation, they pay 10,000 naira.
Okay.
This is what they signed. They don't want where everybody is. They don't want to be known that they have such. So they will have to, for each time they come for anything, they will pay 10,000. But still the test is free. But just they are paying for consultation fee.
Okay.
And then there are some people that will decide to get their medication from the pharmacy. It's there, but it's expensive. Even this PrEP and PEP, these preventive drugs, they are in the pharmacy. You find them, but they are very expensive.
All right. So it's best to go to the clinic. They'll give you and give you your counseling and all that you need to.
Everything you need about HIV is free.
Oh wow! So you now wonder why people are running away from it. Okay, there's no question I want to ask. I don't want to. I'm glad we've established that it's free and in the general hospital. So if you go to the general hospital, you get it for free. You can get your counseling. If you're not sure, go and check in to get your pre-medication or the post-med, whichever one. But just as you explained it, please go to the healthcare facility and get help. Don't sit down there and because that's part of the problem.
Of course.
Not going for the right treatment. And when you're taking this treatment, you're looking healthy and you're fine, isn't it? So you're not going to lose weight. And the mindset of it is, oh, this person is losing weight. Are you sure he doesn't have AIDS? It's going to check you.
It doesn't show.
It doesn't show. Just take your medication.
When I was small, said, hey, they show for it. It is real. It doesn't show. In fact, some people that are even positive are more healthier than people that are not.
They are not. Okay. So even when you're taking the medication, your body is fine and perfect.
You are not restricted to certain food. Don't eat it. No. Nobody.
You take everything you. Okay, that's beautiful to know. So let's go to the question of why women have it more, because I'm actually surprised to hear that, to read that or to find that. Why are women having it more? As in, is it that we're more promiscuous? I don't want to believe so.
Okay.
Yeah.
It's not really that, but then it is, even looking at every other thing. Some women are always more vulnerable to
most
and
things.
Then, in this case, there is this gender inequality. In sexual activities, women sometimes doesn't have the right. There's this barrier for them to even choose whether to have a safe sex or not.
Okay.
That is it. Okay, you can imagine a man that is sleeping with different women.
Yeah.
If the person is positive, he's already sharing it.
Okay.
And then by the time some women will now be like the lady I talked about that, she came in and she said she told the guy that can't you use, the guy said that he doesn't like condom. And then so which means possibly she was paid for that.
Yeah, she's
and then the guy said, I don't want to use condom. And then she consented to that.
Okay.
So they don't have sometimes, and okay, let me even talk about the married people. It sounds somehow when a married woman will tell the husband, please can we use condom, knowing fully well that the husband is cheating.
Yeah.
And then the person is saying, can we, and the man is saying, how can my own wife, the woman I paid to marry, and then he's telling me to use condom, and it will become a problem. And then the woman will have no choice than to
come and permit.
By the time they will have family meetings and all that. So, and then there is another thing, this sexual violence.
Yeah.
Women are being raped. Women are being molested on daily basis. In fact, even children. Adults are being raped, they are being molested, even children. So when these things are happening, it increases their chances of getting infected.
Yes.
And some of these people, by the time it happens, they will still come. They won't know what to do. In fact, there is one that she was when we got to know that she's positive. She started. In fact, it will even take time to even explain to them. She started crying. She was raped.
No dear.
She was raped, and then she didn't know that something can be done.
Yes.
It was when they came later on. They're like, why didn't you
come out and
even go to the hospital? I know she was traumatized. Yes. She couldn't even do anything. She couldn't talk to anybody. Had it been she spoke up that moment, someone could have done something. Maybe they'll even go to the hospital to even check other infections. By checking other infections,
you may find out about
check
this
for HIV. So these are the reasons why the rates at which women are getting HIV infection is high.
And one man can infect so many women,
Well,
because
of
they have the
course.
capacity to do so. It's quite sad.
And okay, there is one man that he married, and then the wife is, I don't know whether it was along the line the woman got blind, and then the man got HIV, and he was so wicked not to tell the wife. And instead of him getting to, he already knew that he can access care, but he was wicked enough to give it to the wife so that both of them will be coming to collect medication.
Wow.
So you can imagine, some people will be aware. In fact, it's just once I have seen a woman that got the husband infected.
Okay, so the infection come more from the men, actually. It's easier from the men, because the women are more exposed in receiving, from the men. And we also have fluids that can help all. So, well, this is amazing. There's just a lot going on in my head, because when I hear this word, the abuse on women, bringing them, this is the reason why we are having more women. It's not because every woman is promiscuous. It's just because
all things being equal.
Yes.
It can even be, you will not see that men have the greater
percentage. But it's because they have the ability, that's this inequality, amongst men and women. So I want to, because this is, our church program, because I would like to say, just to avoid all this problem, in as much as there are other means, we know that the larger percentage of it is through sexual intercourse. So if abstinence is is the key to it. Abstinence is the key to it. If you don't get involved, in fact, there's so many ailments that you can get from just sexual intercourse. So if you stay away from it, you've solved a part of a chunk of the problem of taking this medication, pre-med, post-med, ARTs, and all that. You avoid all those problems if you just...
And it's not easy. You can imagine somebody taking... If you ever had malaria and you know that you are taking medication for 7 days,
it's overwhelming. Yes, it's stressful.
And somebody that is taking drugs
for the rest of your life. And when you can just avoid it and of course, people that get pricked from needle and all that can also go for if they've been exposed, they're not sure, can also go for the pre-med and the post-med and all of that to get those treatment. But we know how it is majorly transmitted. So abstinence is the key. If you can, you should actually. Abstinence is the key, so that you don't go through the stress of drinking medication for the rest of your life. So we're wrapping up now, and I wanted to ask, how can the government has played a good role, because from what you're saying, if the medication is free, treatment is free in general hospital, then just carry yourself and go there and get the help you need. But how can the church as a whole help? In this, because I know by 2030, there's a vision to actually get rid of the pandemic. And if you're hearing that we're increasing again, there's problems. So how can the church help in this particular issue, helping it reduce,
Okay, the thing is that the church shouldn't shy away from the fact that there is HIV and then anybody can get it. Okay, they should also have this maybe occasional testing for their members.
Okay.
They can organize testing, and then, or I don't know if there is, like, so for some churches that have hospitals, like for some dioceses that have hospitals, they can know how to work hand in with maybe NGOs, so that if they got people tested and they are positive, they can refer them. They can be a referral to the hospital, or better still, some of these NGOs, they will be willing to have a stand.
Yes, in the hospital, in every church,
Because even their major target is still to eliminate this. So when you welcome them, so the church should make effort to get people tested or sensitize their members. There should be sensitization in the church.
Yeah.
Like there are some churches that are already doing having teaching Sundays, teaching sermons. Like once in a month, they will just, for someone, there will be just a short exhortation, and then they will get one topic and talk about it. Yes. They can even do this kind of thing, and then people will be aware that this is. In fact, there was one day that on my own, I said I want to get some people. It was in January, in youth fellowship. I said the first 10 people that will come for fellowship that day, there will be HIV testing for free. Then at a point I increased it. Even when I was coming, At a point I said, okay, I think I said 20 or there about 15, but I got more testing
Done.
strips.
Okay, just in
was
case,
a
yeah.
rapid test. But unfortunately, even the people that some of them that came early, some refused to have themselves.
Probably they're afraid.
I told them that the reason why I'm doing this is not because I want to see someone that is positive here, but for them to know their status. So if the church should organize something like that, they can sensitize them, tell them the implication, tell them that there are ways you can even prevent it. Tell them that even when you get exposed, there are things that could be done. They will know that, because they are, people are actually afraid. They don't want to be known,
yes.
or they don't even want to get it. But they will have to know so that even when they are being exposed, there are things that could be done. Something can actually be done so that they don't get it.
Yes,
like
yes,
this PEP
yes.
that we are ahead. So if church can have a sensitization, maybe occasionally, then if they can do testing too for their members, that's a way to cover up this thing. They should not, I think HIV, they don't want to, I don't know whether I will say that, basically they don't want to talk about HIV because they must have to talk about sex, they must have to, because
they're running away from saying the truth.
Saying the truth, because they don't want to, to look as if you are encouraging somebody to have sex. There is a drug they will give you when you want to have sex.
No,
but that's not it.
Yes, I think that's the mindset. Yes,
that's
yes.
not it. So that let it not be that they want to tell people that they want to promote sex. That is not it.
That's
what about the people that are being exposed?
And they don't even know, or it's not their fault that they were exposed. Just like today, I found out that, if you've been abused, sexually abused, or you've been exposed, you don't know, you're not sure, you can walk into the hospital and start a treatment within 72 hours to start treatment, so that it can save you from this.
So the church have to do something, but there is something. We know that government is really trying, but then there is still something. There are key population group, like these sex workers. If there's a way they can, because then they can't walk into the hospital.
Okay, can go and meet them.
Yes, to go there, meet them there, like this. Even in camp, IDP camps.
Yes, there's so many being exposed.
Like, so if they can still go in there and know how to help them, if you don't be surprised that if you can go to this IDP camp and get them tested, you will have a very good number of persons that are positive. So if the government should still trace their way into these
places, yes. Isn't prisons? I read the statistics that talks about prisons. Yeah.
These health workers just target them, tell them that you don't need to. Well, that even if they want, they can still call. There's a way they will even do it that they will be free, even when they don't want to go to the hospital, because they are citizens. They have this right.
Yes,
you have to help them.
Wow.
So
thank you, thank you so much.
Individuals, so they should do something.
Yes.
But since some individuals are not aware, there are people that if you don't tell them, they don't know. They will not be like, wow, I don't even know this.
Yes,
there are sometimes I will not be like, even some things that people can
on their own should
can
know.
Just ask
they don't
questions.
Know. So you wonder what people are doing on social media, looking for something else and not what is necessary. All right, thank you so much for coming on the program. It's so good to have you on the program, and thank you for the information you're giving us today. Just like I was listening to the, I think he's a current DG of NACA, and they asked him what is the #1 problem, and he said people do not even know their status. That's already a problem for them. That's already a problem, and because people don't know their status, they don't even know what to do. So the beginning is to go and find out your HIV status. And the good news is that it's actually free. So please, if you're watching us today, make it a point of duty to walk into any healthcare center, especially the general hospitals in your state, and then you find and then get your HIV status known and then commence treatment. My guest today has been Onyedima Okwo. She's a health educator. And we're grateful to her for the information she has passed to us today. She's very passionate about this. She's very passionate about this. And then, as we talked about, there's so much we've dished out today. Please call your friends, call people, watch this program and learn. And then I believe that God, who has given us this wisdom, will help us by what we're doing. Thank you so much for joining us. I am Angela Emeka Ibiwa. I'll see you next time. Bye.